So you've had your operation for your Crohn's disease or ulcerative colitis, but what happens after you've had your operation? How long will it take you to recover? How long will you need to stay in hospital for? Well, I'll be answering these exact questions and more in this video, so make sure you stick around to find out the answers. Hello, welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information, so make sure you hit that subscribe button and the bell to be notified every time I post a video. And if you want to join the exclusive community of people who receive my personal tips and tricks on living with Crohn's disease, then make sure you sign up to my newsletter by hitting the link in the description box below. So what happens when you've had an operation for your Crohn's disease or ulcerative colitis? Well, when you wake up from the anaesthetic, you will be feeling very groggy and sleepy and a bit confused as to where you are, especially as you'd most likely be given some pain medication. But you'll be supervised by the surgical team to make sure you are fully conscious and awake before you are moved back to your ward. Now, depending on what operation you have had and how complex it is, will determine your pain levels. You will most likely be sore in the area that you've had your operation on, but you will be managed with painkillers. Now, you may be given a handheld device where you can administer the painkiller yourself by pressing a button, and it will give you a measured dose of painkiller. Now, your pain levels and the type of operation you have will determine when you will be allowed to get out of bed and move about. If it's a simple operation, you may be allowed to go home the same day and be able to continue your normal day-to-day activities after a few days rest. But if it's a major operation, you will most likely be bedbound for some time before healthcare staff will encourage you to sit up in bed, sit on the edge of the bed, and eventually get out and sit on the chair next to your hospital bed. Now, the sooner you can get moving, the better, because moving helps with your circulation, allowing good blood flow around your body, but it's also important to make sure that your stitches or any wounds that you've had from your surgery are healed properly enough to withstand any movement. And so the last thing you want to do is to rip your stitches. Now, there's a balance that needs to be met, so make sure you take things nice and easy and don't rush your recovery and listen to the advice of your healthcare team. Now, don't be alarmed if you're connected to lots of tubes or lines when you wake up from your operation, because these are just to help monitor your vital signs and to give you fluids and medication, as well as you might have a catheter inserted to drain your urine, which is a way for doctors to measure your fluid output. Now, also depending on what type of operation you have will determine when you are able to eat and drink again. In some cases, you may have a nasogastric tube fitted, which is a thin tube that goes through your nose, down your esophagus, into your stomach to help give you nutrients if eating is too difficult for you. You may not be able to eat or drink straight away, and so doctors may wait until they can hear bowel sounds or until you've passed wind, which is a sign that your gut is moving and working normally. You won't be having 3-course meals straight away, but you'll start off with light and simple foods to get you back into the eating routine. Now, if you've had a stoma created, then specialist nurse will be involved in your care to show you how to care for your stoma and change your bag, as well as giving you the necessary diet advice. Now, staying in hospital isn't the most ideal situation, but you are in the best place to be treated if anything else comes up, and depending on the operation you've had will also determine the amount of time you will need to stay before you are discharged. What you'll find is that if you've had a laparoscopic procedure, which is just another way of saying keyhole surgery, you will spend a shorter time in hospital than if you were to have a major surgery. Now, lastly, make sure there is someone who is able to pick you up from the hospital and take you straight home, as the last thing you want to do is rely on public transport. Now, you may also find that you still feel a bit rubbish after a few days post-op, and that's normal because just remember, your body has been through a lot, and so you just need some time to recover. Now, don't rush your recovery and make sure you take the time to heal and get your strength back. And don't be a hero and try to do things yourself or try to return to your normal activities straight away. Get someone to help you with things that require a lot of effort, no matter how embarrassing it is. So now make sure you check out these videos for more useful tips, tricks and information on Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this, and I can't wait to see you all in the next episode.